Yep.
Okay, let me share my slide first. Can. Is it full screen? Yeah. Okay, can. So hi, I'm here again. So today I would like to talk about how do you get the history taking from the patient with chest pain. And after that, I also would like to talk about some of the benefit or subsidized in Singapore, since most of you all will come back after your graduation to come back to Singapore. So it will be good that you familiar some of the subsidy or some of the policies in Singapore lah, in Chinese term. Okay. So chest pain is also one of the, it's not very common, but it's one of the symptoms that actually you have to alert, because we worry about heart attack, right? So in primary care, so usually you have to get a detailed history to look out for any red flag symptoms, whether the patient is need to refer to the emergency department or just because of some muscular pain that you can monitor in the primary care. So in chest pain, in general Chinese, we call 胸口痛. So 胸口 is chest lah, 痛 is pain. So another term for pain is called 疼. So 痛 or 疼 also can. Yeah. So as usual, if your patient presented with pain, because where is the pain, is like abdomen or chest, you can ask regarding the nature of the pain. Is it sharp pain, 刺疼, or dull pain, 沉痛, or burning pain, is the 烧痛. So is it the pain is intermittent? In Chinese we'll call 一阵一阵的痛. If a pain is persistent, we'll call 持续的痛. And another thing you want to rule out is whether the pain is related to the jaw or shoulder or back or not. If the pain is related to the jaw or on the shoulder, then we worry about maybe potential of heart attack. If the pain is related to the back, then we will concern whether it's a coarctation or aorta, or sometimes if a patient presented with very atypical, like it can be present as a pancreatitis as well. So in Chinese we call radiation pain. In direct translation, you can say 痛跑到下巴或肩膀. That is 背 in Chinese. So you also want to ask regarding the pain score as well. So from 0 to 10, what's your pain score? So you can ask 0到10，那个痛是多少？呀，1、2、3、4、5、6、7、8、9、10。So and aggravating factor and relieving factor. So in Chinese you can direct translate 痛更加严重当你So in China 痛 is pain, 更加严重 is and worsening 当你 when you running, when you running in Chinese called 跑climbing stair 爬梯，或者 or another term is 爬楼梯and or when you stress 压力so or lying flat is 躺平usually if lying flat you got pain, right? Then the another thing we to see whether the patient have any acid reflux or not. And some people, and another differential is some people have any heart failure, right? Then you will feel a bit chest discomfort, or some people have shortness of breath when you lie flat. So sometimes you can ask, usually when you sleep 1 pillow, 2 pillow, yeah. And is it more relief when you are sitting up? And you also want to ask whether the pain is more worsening when you have take a deep breath or not. Some people have this puritic chest pain, which is maybe suggestions of pneumonia. So you say 深呼吸 is take deep breath. Okay. And also whether it's related to your gastritis or not. Is it before meal or after meal? Before meal we call 饭前. After meal we call 饭后. So usually, like for example, some of the this kind of before or after, we can roughly guide us whether the ulcer, peptic ulcer, is at the gastric side or duodenum side. So before meal, sometimes it can be due to the gastric ulcer, and after meal, the pain is more worsening. It can be the localized in the duodenum side. right? And what is the relating factor? In Chinese, we can direct translate that 痛有所缓解，缓解 is more relief. 当你 when you okay resting 休息 okay sitting up 坐起来or after meal 饭后 and you would like to ask some associated symptom and interestingly a lot of heart attack like 30 to 40% of heart attack doesn't present very obvious that chest pain. It doesn't present with chest pain at all. It's just presented with some associated symptom like some numbness, some even presented with some abdominal pain and diarrhea, which abdominal pain is at the upper side. So as a primary care, sometimes you have to more alert and sometimes you have to stratify and see the risk factor of the patient. So you also have to ask regarding the associated symptom. Like for example, nausea, vomiting, 呕吐. O is nausea, vomiting is 吐. Whether got sweating or not. 流汗. Giddiness 头晕. Difficulty breathing. In Chinese we call 呼吸困难. Or in another term we call 喘. Got fever or not? 有发烧吗? Numbness of the hands. 手麻痹. Hand is 手. 麻痹 is numbness. Okay. Some people presented only numbness, and then you see, oh, this patient got history of heart condition before, then you'll be more vigilant on that. Or patient have any symptom of in upper respiratory tract infection or not, or for example, patient got cough or not. So 咳嗽 in Chinese, runny nose, 流鼻涕 or sneezing 打喷嚏. As usual, in medical school, even in exam in master, postgraduate diploma, or even in the clinical practice, you have to also ask ample all the cases, most of the cases lah. So ample you including allergic, allergic. So 有药物敏感吗? Any medicine you are taking, 有吃什么药吗? Past medical history, 有什么病历吗? And past surgical history. 有做过什么手术吗? And sometimes if you're thinking, oh, this patient need to go for operations, especially you're in the hospital when you're a medical officer, then you have to ask last eat and drink. 最后一次吃喝是几时? Basically in ample, E is event. So event usually is the associated symptom and the disease progress. But in here, we'll also ask regarding the patient's social history also as in the primary care. So you ask, 你做什么工? And whether you drink alcohol or not. 有喝酒吗? 喝多少酒? How many you drink per week? 一个星期喝多少? Smoking, 有抽烟吗? 抽烟 is smoking. So always if you want to ask question, the 吗 in the end of the word. So 有抽烟吗? 吸多少烟? You smoke how many? So and also don't forget to ask regarding the patient weight and height also. 体重体高. Okay, after you get the history, of course you do examinations. 我要做检查, then you proceed for examinations. Okay, and after examination you want to do investigation, right? And some of the term actually it will be good that you know in Chinese. So one of the common term that you have to use if a patient has chest pain is ECG. So in Chinese we call 心电图. And sometimes you want to do a blood test, right? But then you say, oh, 抽血. 抽血 for what? For example, 抽血看 whether got anemic or not. 抽血看有没有贫血. And sometimes you want to do urine test, right? Especially female reported age, you want to check whether got pregnant or not. 验尿看有没有怀孕. And sometimes you want to do an X-ray just to make sure there's no pneumonia. Then you can proceed for X-ray, right? Then 照 X 光. And sometimes you're a bit concerned whether patient is actually gastritis, that we worry about the peptic ulcer, and then you have to explain to the patient that actually you want to go for scope, OGD scope. In Chinese, endoscope. In general, we call 内窥镜. So what's the common diagnosis for chest pain is one that we must rule out or is a heart attack. So in Chinese we call 心脏病. And another is pneumonia. Pneumonia is 肺炎. In teenager, very teen, very young age, especially guy, usually it's one of the risk factor that presented with pneumothorax. A lot of people NS suddenly got this shortness of breath, and then you say, oh, listen the lung actually got reduced air entry the one side of the lung, then you worry about pneumothorax. So in Chinese called 气胸. Peptic ulcer we call 内溃疡. Pancreatitis we call 胰脏炎. Yen actually is inflammation. So whatever organ inflammation, like for example, is gastritis, we call 胃炎. In pancreatitis we call 胰脏炎. So then after that you have to explain to the patients. You have to what management you want to do for her, for him or her. So if a patient has a heart attack, so you have to tell the patient you have to immediately go to emergency department. So in Chinese we call 去急诊部门. And don't forget, if a patient has a heart attack, as a primary care, also you have to load the patient with blood thinner. So like for example aspirin, right? So you have to facilitate the management in the emergency department. So you can start with aspirin. So aspirin, when you're loading, is how many? What's the dose of the loading? Is 300 mg. Is 3 times of the usual dose of the aspirins. And this is also important. Also ask the patient whether got allergy or not. That's why the reason of all the history taking ample is very important. And after you take the presenting complaints. So if a patient is allergic to aspirin, what are you going to do? Then you can you can use an alternative blood thinner. You call Plavix, clopidogrel. And so you have to in Chinese blood thinner in general we call 血包药. 药 actually is medicine. So stomach protection medicine is, for example, if patient present with more suggestive gastritis, then you want to give some gastric medicine, like for example omeprazole, famotidine. Then you say 保胃药. And if patient is presented with pneumonia, then you are giving antibiotic. In general, antibiotic called 抗生素. But I don't think you all need to know more specific what antibiotic, like for example penicillin in Chinese called what. Although some I know is called 青霉素 for penicillin, but I don't think in general no need to know in detail what is clarithromycin, what is penicillin, what is Bactrim in Chinese. But if you're interested, you can go and find out. And cholesterol medicine, in Chinese we call 胆固醇药. Hypertension medicine we call 高血压药. So after you give the medicine to the patient, you have to make sure the patient whether got compliance to the medications or not, and whether got side effect of the medications. So then you have to ask the patient, 有按时吃药吗？按时服药吗？ Yeah. So whether got side effect or not, 有副作用吗？ So you are also prompt to ask regarding what is the side effect that you are looking for. Like for example, giddiness. If a patient, like for example, high blood pressure, you just recently start high blood pressure medicine, the patient feel giddy. So in Chinese, we'll call 头晕. Maybe you actually give too much of the high blood pressure medicine. Maybe you have to reduce the dose. And sometimes the patient has diabetes, you just start the medication. Like for example, gliclazide, which is more prone to have hypoglycemia. Then you have to ask the patient, 有头晕吗? If when you start the medications. 咳嗽, yeah, one of the medication that cause high blood pressure medicine and cause cough is ACE inhibitor, right? Perindopril. But it's actually a very good medication for hypertension because they can protect the kidney and also heart conditions as well. So, but you always when your patient come back, you say ask whether got 咳嗽吗 or got cough or not. If a patient got cough, sometimes you can switch to another group called losartan, the ARB. And if your patient, you start some cholesterol medicine, right, like statin, right, and sometimes one of the side effects you ask is muscle ache, rhabdomyolysis. So 肌肉酸痛吗？有肌肉酸痛吗？ Although very rare, but you can ask, okay. And if a patient is started on blood thinner, then you have to make sure there's no gastritis, right? Then you ask 胃痛有胃痛吗？So diarrhea also, when if you start antibiotics, then you have to explain to the patients that 有一些人会有泻肚子diarrhea. Okay, so far any question regarding the history taking in general or also in chest pain? No, okay, can. So I would like to also touch about that some of the primary care, right, to emphasize for the patients, especially elderly. Okay, one is LPA, AMD, and ACP. You all heard about before what is LPA, AMD, and ACP? So LPA actually is lasting power attorney. Lasting power attorney in Chinese is called 持久授权书. So lasting power attorney is actually a legal documents actually to give to let the patients to give the attorney to the donee, which give if the patient have in case in future lost mental capacity, so the donee can decide for him regarding the her property or the finance welfare affair, property and affair, or the personal welfare. Like for example, yeah, one patients that actually suddenly got accident and then how do you manage regarding the banking issue? Because a lot of time if you didn't decide, right, especially it's a big family, right, there's a lot of conflicts. So this one we actually primary care also emphasize to think about it in advance so that don't have any conflict in the future. So in primary care, some of the accredited doctor actually can do for you all, and then you just submit to the Ministry of Social Family, I forgot the MSF, so that they can they can keep for you this legal document. Or in Chinese we call 持久授权书. And another thing is advanced medical directive. So what is advanced medical directive? Is also a legal document. Is when you are terminally ill, you request or not for extraordinary life support. For example, CPR, like intubations, yeah. And this document only activated when you are lost mental capacity. And these two, like LPA and AMD, is anytime you can change if you still have mental capacity. So in Chinese, advanced medical directive we call 预先医疗指示. So this one all actually you can Google out what lasting power attorney and also advanced medical directive. Actually very easy. You can Google out the form and you just print out and then fill in the form, and then you can just look at for any primary care that wish accredited to do LPA, then they can sign for you and make sure you understand what is it, and then you submit to the respective department, and then they can document for you. So another thing is advanced care planning. So advanced care planning is also a very good idea or plan that actually you have to you wish to know that what medical treatment you wish to have. So like for example, in case you have certain disease, what you are keen to do. Yeah, so although this one is not the legal document, but this one you can go to like we call AIC, one of the department that actually can the coordinator will talk to you, and then they will document what your wish. Actually, is a booklet to go through the list, and then this document actually will put in the national electronic record. So every time actually you go to public hospital and then the doctor open up the national electronic record, right? They will say, oh, you got this ACP before, and when the doctor will go through, they roughly know, oh, actually you wish to do what, so that more give you a comfort that actually doctor know actually what you want to. So in Chinese we'll call 预先护理计划. Will is 遗嘱啦. 遗嘱 is when you pass away, you want to pass your property to who. Okay, and some of the medical term, if you want to try like speak to an auntie uncle, right? So lost mental capacity called 失去心智能力. Death in Chinese we call 去世 or another more proper we call 往生啊. Terminally ill we call 绝症. Extraordinary life support we call 维持生命的医疗法. Okay. And sometimes some people still don't know what is it about. So you can give example. 比如说CPR 就是心跳复苏技能intubation 就是插管and also some of the subsidized in Singapore now is what we call Medisave, Chaw, Pioneer Generation, Medica Generation, all have different benefit lah. And also nowadays the Mr. Ong, our Minister of Health, also try to encourage what we call healthier SG. Hopefully by next year we can establish this SG is to let all the chronic disease of especially elderly to take on a fixed primary care doctor, family physicians, so that the family physician will know more what condition is it, instead of the patient keep hawking to different doctor that actually the approach will be not so good, and sometimes every time the doctor see you have to retake all the history again. So yeah, this is how they achieve. So in medicine is actually that once you work, then you have to pay for CPF, then certain portion of the fund will be keep in the medicine. In Chinese we'll call 保健储蓄. Chaw is another subsidized by the government, like for example you have chronic disease, and then the Chaw on top of the medicine you can use Chaw to the government will give you some subsidies, and the subsidies actually depend on your income also. So all the Singaporeans is eligible for Chaw, so go and apply the Chaw. But of course the benefit is different from according to color, green color, orange color, and the blue color. So green color actually only for chronic disease subsidized. Chaw, orange and blue actually in acute condition actually you can also use for certain subsidies when you go to the Chaw clinic. So in Chinese, Chaw we call 社保援助计划. So and another we call Merdeka and Pioneer Generation, especially for the elderly. So in Pioneer Generation we call 建国一代. In Merdeka Generation we call 立国一代. All got benefit in terms of the chronic disease and the acute disease lah. Another last and not least, actually primary care also emphasize preventions, especially vaccination, and government also subsidize for most of the vaccination also if you are indicated. So it will be good that actually you know what vaccination in Chinese as well. So like for example HPV, it's a bit complicated for the HPV vaccine is translated in Chinese. If you want to know in medical term, it's 人类乳头病毒疫苗. So most of the time I will just translate that what actually is the purpose of this HPV vaccine. So this HPV vaccine is to prevent cervical cancer, right? So 你说疫苗避免子宫颈癌. Although guy also can get the HPV vaccine to reduce anal cancer and the ear throat cancer, right? So but most common we are encouraged and government got subsidized for the female teenager. So those you all haven't get the HPV vaccine before 26, better go and get now. So yeah, government got subsidized for you all. In fact, actually the health promotion board got push you all, give you a letter to go to tell you all to go to certain clinic to do for free. Flu, I believe in UK they are very emphasized on the influenza vaccine, right? In Singapore, yeah, we emphasize in certain age group, and also if you have any chronic condition, for example heart condition like asthma, COPD, yeah, then patient eligible for subsidized. In Chinese we call 流感疫苗. In the patient, if more than 65 years old, also eligible for subsidized for flu vaccine. So certain clinic even is free of charge because after subsidized, no need to pay anything. And after 65, we also encourage a patient to get the pneumococcal vaccine, or in Chinese we'll call 肺炎疫苗. Basically, 疫苗 is vaccination in Chinese, because a lot of cases, like for example, elderly go to hospital, suddenly get the HAP, hospital acquired pneumonia. and then pass away. Then mortality is high is because of pneumonia. So that's why we are pushing all the elderly to get the pneumococcal vaccine. And tetanus vaccine, actually tetanus vaccine and diphtheria and pertussis is combined most of the time, unless you want to do the tetanus vaccine for, like, for example, you're injured by a rusty metal, very high risk tetanus, then you can get the isolated tetanus vaccine. But most of the time, we are also emphasized for tetanus, diphtheria, pertussis vaccine for children and also for pregnant women as well. So usually TDAP vaccine actually for pregnant women each pregnancy, or some healthcare worker we also encourage every 10 years to get it. In tetanus we call 破伤风疫苗. Diphtheria and pertussis in Chinese we call 百猴还有百日咳. Or 百日咳 is because the kid will always keep coughing. And MMR. So in kid, we usually to emphasize MMR. That's why, because of a compliance of the MMR vaccine is very good, then the measles outbreak actually is suppressed for years already. So, but we have to continue our effort to to prevent the outbreak of the measles, especially measles. So, healthcare worker, kid, we always emphasize on MMR vaccinations. So in Chinese, mum we call 晒先炎, measles we call 麻疹, rubella we call 风疹. 风疹 another is we call German measles, so it's a 德国麻疹. I guess it's because this rubella is start from German. So another B 型肝炎 is hepatitis B vaccinations. That's it. So any questions? I guess on top of the that teach you all the Chinese, I also share some of the history taking, how you get, because I understood that actually most of you all are medical student, year 3, year 4, year 2, right? And once you go into clinical year, you have to start to learn how to get the history taking in skill lah. And actually this is very good because in future, even you become a doctor, medical officer, actually thorough history taking is very important, especially in primary care, because you want to, like, you are a detector, then you have to know, okay, actually what issue you have and whether the patient need to be referred and how do you handle on that. Examinations and slowly for step by step for investigations. Yeah, even your exam also, if you go for a long case, then just step by step, don't jump, or you know the disease, then you straight away jump to a disease. Although you know the answer, everything, right? Then at the end, you don't score the point for history. At the end, you will just cook up. Yeah. But in exam, actually most of the time, you have to know what exam is it. Is it a short case, long case, and then how they score the exam. So usually before the exam, actually you have to know what structure of the exam is. Yeah.
Okay. Thank you, Dr. Tan, for the very detailed sharing. Participants, if you have any questions, feel free to unmute yourself or send it in the chat. Okay, I think we have one question.
Dr. Tan, not sure if you can see the question, but it's a question from Gigi, and she's asking, how do you say financial counseling, social services, and MSF in Chinese?
Oh, okay. So, like for example, you have some financial, you're asking a patient for any financial concern, financial in Chinese called 经济, so 你说有经济上的问题吗? You got any financial problem or not? So if a patient got any financial problem, if you want to refer to MSW, right, especially if you're in the hospital, right, then 我们refer 你去看社工, so of course, sometimes the patient really have any difficult, even in primary care, like you have an NGO like 慈济, actually helping also, like 我们会 refer 你去看社工，社工会帮你讲解, will explain to you how to benefit on that. Actually in Singapore, a lot of NGO, like for example 慈济, and they actually can help out for all the elderly, have financial constraint, everything. Yeah. So in financial counseling, 经济上的问题，有经济上的问题吗 ？And they bring out 个问题，then you refer 去社工，yeah. But if you know some financial help that you can help to apply, then of course it's very good lah. Most of the time, a doctor just refer to 社工 MSW, medical social worker. Any other thing? Or you all want, like, for example, like practicing like how to history taking in chest pain in Chinese, like last time I do in last week?
Yeah, I think if there are no more questions, we can move on to the scenarios. If anyone wants to have a go at history taking in Chinese, you can unmute yourself and just do a quick introduction.